This is BSC2085C, summer 2002. This is chapter 14, the autonomic nervous system, the last chapter of the nervous system. Chapter 15 will include the special senses, and chapter 16 will include the endocrine system. As you can see, the central nervous system includes the has as a feeder into it the peripheral nervous system, which has a sensory afferent branch and a motor branch. Okay, and remember, we don't want to get confused on the motor branch because it not only means the voluntary muscles, but it also means muscles and glands and things like that related to the autonomic nervous system. So we have the somatic nervous system, the autonomic nervous system, and the autonomic nervous system is divided into the sympathetic nervous system and the parasympathetic nervous system. In comparison to the portions of the motor efferent division, okay, of the peripheral nervous system, the somatic versus the autonomic nervous system, the effectors, okay, what it's going to act on in the somatic portion efferent as opposed to autonomic visceral is skeletal muscle, and autonomic is cardiac, smooth muscle, and glands. Type of control, as you can imagine with the voluntary muscles, is voluntary. Autonomic nervous system is involuntary. Neural pass for the somatic efferent system is one efferent neuron from the central nervous system to the effector. Remember that cell body for that efferent neuron is in the anterior or ventral horn, okay? As opposed to the autonomic nervous system, we have two neurons from the central nervous system effector synapsing with ganglia. So this is an exception that ganglia are always inside the central nervous system. We now have in the autonomic nervous system, we have ganglia which are outside of the central nervous system. Actions with regards to the voluntary muscles is excitatory. Actions with regard to the autonomic nervous system is either excitatory or inhibitory. An example would be the GI system. If we're in a fight or flight reflex, which is a sympathetic nervous system, then we have inhibition of the GI system. We don't need to be doing digestion at the time, as opposed to once we're out of that situation, then the parasympathetic system kicks in, and that's excitatory. So we can have, in the autonomic nervous system, we can have dual actions, one excitatory and one inhibitory, with a few exceptions. In the somatic nervous system, the autonomic nervous system, as you will remember when we talked about muscle and the motor end plate, we were dealing with acetylcholine. In the autonomic nervous system, we deal with acetylcholine and norepinephrine. The anatomy of the autonomic nervous system, the sympathetic portion of the autonomic nervous system is primarily from T1 to L2. The sympathetic portion of the autonomic nervous system is primarily from T1 to L2. The parasympathetic system deals primarily with four cranial nerves, okay, that we talked about in our nerve sheet, and a couple of branches down here off of the sacral portion of the spinal cord. So the two categories are based on origin, length of fibers, preganglionic and postganglionic, and they are different in the sympathetic and parasympathetic, and the location of the ganglia are different in the sympathetic and the parasympathetic. Sympathetic or thoracolumbar division. I said that division starts at T1 and goes down to L2, and it is primarily for the sympathetic innervation of body organs from the head and neck area down into the pelvic area. But the nerves that are responsible for innervation come off of T1 to L2, okay? In the sympathetic or pre-thoracolumbar division, Preganglionic cell bodies are located in spinal cord segments T1 to L2. We've already mentioned that. And they synapse in the synaptic trunk. Okay, they synapse in the synaptic trunk. Relatively short preganglionic fibers may take 1 to 3 passes. The doesn't show the picture here, but it will show a picture later on. The synaptic trunk is a bilateral structure on each side of the spinal cord, bilateral structure on each side of the spinal cord or spinal columns. And that is where remember, there's always 2 fibers in the autonomic nervous system. The first fiber is the preganglionic fiber is going to be very short because it comes from the spinal cord to the sympathetic trunk, which is right outside the spinal cord. Relatively short preganglionic fibers may take 1 to 3 passes. Okay, they can synapse at the same level. So they come out of, and now notice that the sympathetic fibers come out of the lateral horn. Okay, we had a ventral or anterior horn. We were talking about the gray matter, a lateral horn, and a posterior or dorsal horn. Okay, well, the anterior horn of the gray matter was primarily efferent motor, voluntary muscle. The sympathetic comes out of the lateral horn, which is one of the reasons that we primarily have the lateral horns only in the thoracic, thoracolumbar area, where the sympathetic is autonomic nervous system is present. Okay, so you can synapse at the same level. You would come out here. Okay, you're coming out here through our ventral root into our mixed spinal nerve, and then we're into our sympathetic trunk right here. We're into the sympathetic trunk right here, and we're going to have our synapse right here. So we've come out right here, and so here is our preganglionic fiber, sympathetic fiber, short fiber, preganglionic fiber coming out and synapsing in the sympathetic trunk on the same level where it comes out. So if it came out at T1 or T2, T3, it would synapse at that same level. It can synapse at a higher or lower level. So here it is coming out, the preganglionic fiber. And so rather than synapse at the sympathetic trunk, this is a sympathetic trunk on each side of the spinal cord, it can either go up or down to a higher or lower level, and then synapse, and then have the postganglionic fiber coming out after that. It can synapse in a distal collateral ganglion, okay? In a distant collateral ganglion, namely the prevertebral ganglion forming the splanchnic nerves, okay? These are not paired. They are anterior to the vertebral column. Remember, the sympathetic trunks are bilateral on each side of the spinal column, but the splanchnic trunks, okay, the splanchnic trunks are not paired. They're on the anterior. They're anterior to the vertebral column. So the preganglionic fiber would come out, okay, go through the sympathetic trunk. It would not synapse there, but then go out to one of these splanchnic nerves, splanchnic ganglion, which are anterior to the vertebral column. So it has 3 methods. It can come out the same level and synapse the preganglionic fiber. We're talking about the first fiber. All the autonomic fibers have 2 fibers, preganglionic, postganglionic. First fiber comes out and synapses at the same level in the sympathetic trunk. The next option is can come out and synapse either at a higher or lower level in the sympathetic trunk. That's a preganglionic fiber. Or lastly, it can synapse in a distal collateral ganglia, namely the prevertebral ganglia forming the splanchnic nerves, which primarily go to the GI system. And these ganglia are not paired, and they're anterior as opposed to being bilateral to the vertebral column. Relatively long postganglionic neurons, okay? Because now you have had your first synapse. So your first ganglion, your first neuron went from the lateral horn of the spinal cord, literally just outside of the spinal column, either to the sympathetic trunk or to the anterior trunk, forming this splanchnic. One of the ganglions there, forming the splanchnic nerves. Okay, so the first fiber is going to be relatively short. The second fiber is going to go from that ganglia to whatever organ it innervates. That second fiber will then go from that ganglia where it synapsed to whatever organ it innervates, to the effector cells. So we have a relatively long postganglionic neuron. That's the sympathetic or thoracolumbar division. The parasympathetic or cranial-sacral division comes from four cranial nerves that we discussed previously, and two segments in the sacral portion, okay? Preganglionic fibers originate in these, and it's on your list, the preganglionic portions of the cranial nerves, in cranial nerve 3, 7, 9, and 10. Vagus is 10. 3, 7, 9, and 10. Remember, if you have to write down cranial nerves in one of your discussion questions, the nerve is not written in Arabic numerals, but is written in Roman numerals, okay? So if you don't know Roman numerals, it'd be a good time to learn to write Roman numerals 1 to 12, okay? So the parasympathetic division is made up of these four cranial nerves, 3, 7, 9, and 10, are regions of the spinal cord in the sacral region, segments 2 through 4. Relatively long preganglionic fibers travel to the terminal ganglion, okay, which is located at or near the effector organ. It can actually be on the effector organ. So rather than in the sympathetic system, where that preganglionic fiber travel from the spinal cord to right outside the spinal column, and then the postganglionic fiber traveled from that ganglion right outside the spinal column to the effector organ. In the parasympathetic system, the preganglionic fiber travels from the anastomoses, travels from its innervation in the spinal cord, literally almost to the effector organ, where it synapses with the postganglionic fiber. Okay, so that's a major difference. Now, obviously, you have open book, open notes, but if for a face-to-face exam, that's a critical knowledge point of information. So you want to make sure that when you're evaluating questions, that you understand preganglionic, postganglionic fibers and the difference between the sympathetic and parasympathetic system. And so obviously the postganglionic fiber in the parasympathetic system is very short. Physiology of the autonomic nervous system. The major neurotransmitters, we have two, are acetylcholine and norepinephrine, as opposed to the motor efferent portion of the peripheral nervous system, which had acetylcholine and it was excitatory. In the autonomic nervous system, we have acetylcholine and norepinephrine, and they may be, depending on what the effector is, may be excitatory or inhibitory. Excitatory and inhibitory depending on the type of the receptor. Types of receptors. Cholinergic receptors use acetylcholine, okay? Cholinergic receptors use acetylcholine. Well, that's fairly easy to remember. There are some different types of receptors. The first one we'll talk about is the nicotinic receptors. They are found on sympathetic and parasympathetic ganglion neurons. Hormone-producing cells of the adrenal medulla. This is the second place they're found. Also at skeletal muscle neuromuscular junctions, and they are excitatory. So when we talked about the receptors at the motor end plate, we were talking about these types of receptors. Muscarinic receptors, so we had nicotinic, we have muscarinic receptors found on visceral effector organs, visceral effectors of the organs, parasympathetic target organs, a few sympathetic, and they can be excitatory or inhibitory. So primarily it's parasympathetic, but they are some sympathetic organs, okay? We now have adrenergic, okay, use norepinephrine. We have two types, alpha and beta. We have alpha 1, which is excitatory in smooth muscle and blood vessels, and alpha 2, which is inhibitory in the peripheral nervous system. So we had cholinergic receptors, we had nicotinic and muscarinic, we have adrenergic, and they used acetylcholine. We're now talking about adrenergic receptors that use norepinephrine. We have two types, alpha and beta. Okay, alpha 1 excitatory in smooth muscle, blood vessels, alpha 2 inhibitory in peripheral nervous system. And our beta receptors, beta 1 excitatory, namely the heart, and so beta 1 receptor is excitatory. And so if you've heard of somebody taking a beta blocker, this would be a medication that would be blocking this receptor. And I think, and so that is a blood pressure reducing medication. But you have to be able, you need to know what the person's heart rate is before you put somebody on a beta blocker, because if they have a slow heart rate and you put them on a beta blocker, they'll have an even slower heart rate. Okay. Also, a beta blocker is what some athletes used to use. A lot of golfers used to take beta blockers. I got that tidbit of information from a GI doctor down at Doral when I was playing golf there. Also, a lot of performers, okay, have stage fright, and they take beta blockers because they'll take beta blockers because beta blockers slow their heart rate down. If it slows their heart rate down, they're not nearly as anxious. Okay, so that's a beta 1 receptor, and so beta blockers are used for anxiety. It's not the primary use for anxiety. It would be an off-label use, but they're also used as a blood pressure medicine. Beta 2 is inhibitory, it relaxes small muscle in the respiratory tract. And so if somebody is you want to dilate the bronchioles, you want to relax a smooth muscle around the bronchioles, okay? And that would be something we discuss in anatomy and physiology too. Then you would give a beta, you'd work with a beta 2 receptor to relax the smooth muscle, and that is some of the medication in the inhalers, okay? And then you have beta 3, which is excitatory in adipose cells and causes lipolysis. The function, most organs use dual autonomic innervation. Most organs use dual autonomic innervation. Sympathetic, which are our fight or flight, parasympathetic, which is the opposite. That is our calm down and rest and digest and make urine type thing. This category includes most visceral organs. Effect on organs with dual innervation are antagonistic. As you know, if you have dual innervation, we would want one to be excitatory and one to be inhibitory. Organs with sympathetic innervation only, so these are the 5 organs, okay, that only have sympathetic innervation: sweat glands, adrenal medulla, the kidney, the erector pili. Remember, the erector pili is that little muscle at that bottom of the hair follicles that causes your hair to stand on end, and most blood vessels that are for thermal regulation. In other words, the vessels that are on the superficial surface, primarily the veins, okay, that are for thermal regulation. So these organs only have sympathetic innervation. And so if you have sympathetic innervation on the sweat glands, you're going to sweat. And if you don't have sympathetic innervation on the sweat glands, you're not going to sweat. And so this is a list, okay? In fact, it's 2 pages list of sympathetic and parasympathetic. So this is the way I think about it. This is another one of my Phillipsisms, okay? My memory thing. Sympathetic is fight or flight. That is a T-Rex chasing me, okay? That is a T-Rex dinosaur chasing me. Parasympathetic is either I get away from the dinosaur or my fellow cave people knock the dinosaur in the head and we're sitting around having a great dinner, okay? So when you think about is something sympathetic or parasympathetic, think about it in terms of, do I need to have this functioning if a T-Rex is chasing me, okay? So it's fairly simple if you think about it like that, okay? The iris, do I need to let as much light in as possible? Or do I need to concentrate the light down and just look at a very narrow field. Well, if a T-Rex is chasing me, I'm looking everywhere to how to get away from there. So a sympathetic is going to stimulate the dilator muscles to dilate the pupil. Parasympathetic is going to cause constriction. The eye ciliary muscles. The eye ciliary muscles are the ones that they're going to work on the lens. We'll learn about that next week, okay? The parasympathetic stimulates the muscle, which makes the lens bulb for close vision. Am I reading a contract while the T-Rex is chasing me? No, I do not need close vision, okay? I need to be able to focus on the near and far, but not contract near and far, okay? But not contact near and far. All right, my glands, okay? Nasal, lacrimal, gastric, pancreas. Do I need to be digesting food when the T-Rex is chasing me? The answer is no, okay? The GI system, the GI system essentially is in a decreased mode in the sympathetic system, okay? So in the sympathetic system, it's going to inhibit the secretory activity, constrict the blood vessels supplying the glands. Whereas parasympathetic, the T-Rex, we're grilling the T-Rex over the campfire and we're getting ready to eat, okay? Salivary glands, we can think about the same thing. Sympathetic effects stimulate secretion of thick, viscous saliva, stimulate secretion of watery saliva. That's why when you get nervous, if you're you're going in for a big interview, you have to give a talk, something like that, and you get what's called cotton mouth or dry mouth. That's why it happens, okay? Adrenal medulla, no effect. Parasympathetic stimulates adrenal cells to secrete epinephrine and norepinephrine. So this is one of the organs that only has one effect. Okay, it only has a sympathetic stimulation, doesn't have a parasympathetic. The adrenal medulla. Recta pili, same thing. That's the muscle attached to the hair follicle, causes the hair to stand up and causes goosebumps. Heart muscle. Okay. Sympathetic, parasympathetic. If the T-Rex is chasing me, I need my heart to beat fast and I need for it to beat with force. I need to have as much cardiac output as I can at that particular time. Whereas if I'm no longer being chased by the T-Rex, I no longer have to have that force of contraction and increased heart rate. So sympathetic, being chased by the T-Rex. Parasympathetic, not being chased by the T-Rex. Coronary vessels, dilates the coronary vessels, okay? And there is no parasympathetic. So either the vessels are dilated during sympathetic or there's no effect. The parasympathetic doesn't cause constriction of the coronary vessels. So that's one of the charts. And you can do the same thing here with this other chart. I would advise you to just go down the chart. Sympathetic stimulation, you're being chased by the T-Rex. Parasympathetic stimulation, you're not being chased by the T-Rex. But this would be a good chart to have available to you. Or if a question comes up, is this sympathetic or parasympathetic stimulation? And remember the 5 organs that we talked about that only has sympathetic stimulation, doesn't have parasympathetic stimulation. Generalities concerning the sympathetic nervous system and parasympathetic nervous system, aka the autonomic nervous system. Fight or flight turns on stress response, E division, exercise, excitement, energy. Okay, I like to think of the T-Rex chasing me, and I can work through all this. Okay, I can work through all of this. And so that's how I remember it. And I try to give you these little things that you can file away that come 3, 4, 5 years from now when you're taking your boards and they ask you sympathetic and parasympathetic and you didn't study on that. If you can remember this, remember the T-Rex and eating the T-Rex afterwards. Parasympathetic, resting in the digestive function, increased blood flow to internal organs, decreased blood flow to muscles. Yeah, the muscles would have been on the second chart. Okay. Obviously, if the T-Rex is chasing us, we need maximum blood flow to the muscles, especially our muscles of movement. Okay. And once we're set and resting, We don't need that blood flow to that much blood flow to the muscles. Digestion, defecation, and diuresis. Okay. Control the autonomic nervous system. Hypothalamus is the integration center. Anterior region controls parasympathetic. Posterior region controls sympathetic. So hypothalamus, integration center for the autonomic. Remember, if it's an autonomic nervous system, if it's an autonomic function, and you have the choice of hypothalamus, always pick it, okay? Because you're going to be right 99.9% of the time. It then makes use of the reticular and the limbic system to activate medullary centers and cortex. So we have the hypothalamus that are using these two particular systems, and that is it. And I will get this up and posted.